Hello, I'm Dr. Alix Casler, a board-certified pediatrician with Physician Associates. We're the largest privately owned multi-specialty medical group in Central Florida with over 85 physicians and 17 offices conveniently located throughout the area. Our goal for more than 25 years has been to provide the highest quality medical care to our patients. I believe that immunizing children is the single most important thing pediatricians do to protect our patients' health. It is the ultimate preventative medicine. Immunization should begin within the first few days of life with the first hepatitis B vaccine. The first big set of shots should begin at the 2-month visit. The standard vaccine schedule recommended by the American Academy of Pediatrics and the American Committee on Immunization Practices is the only schedule that should be followed. It is based upon the best medical knowledge to get the most protection safely from childhood vaccines. Combination vaccines make the schedule much easier on our patients by reducing the number of needle pricks without increasing any side effects. There is a huge amount of disinformation that seems very credible if you do not know how to interpret the data on immunization. For example, the onset of autism symptoms often coincides with the timing of vaccines, but autism is known not to be caused by vaccines. Because immunization is so very effective in preventing disease outbreaks, most parents now have never seen cases of the deadly diseases against which we're immunizing, such as polio, measles, and whooping cough. This makes it hard to understand the incredible value that immunizations offer in protecting their children's health and well-being. Most of the diseases against which we immunize are potentially deadly. When I was in my residency training from 1987 to 1990, we didn't have vaccines against Hib or pneumococcus. We had an entire bacterial meningitis ward at the Children's Hospital of Los Angeles, and we admitted several children each day with bacterial meningitis caused by one of these two bacteria. We could actually tell which bug caused the meningitis by looking at the pattern of brain damage on the child's CT scan. I have not seen a case of these diseases in over 10 years, all because we immunize. There are only a few cases where certain immunizations are not recommended. Those include rare immunodeficiencies or allergy to a vaccine. When being vaccinated, crying is a normal response for the child, but when the parent stays calm and, afterwards, cuddles or praises the child, it reduces the child's awareness of their stress. Most vaccines cause no side effects or mild local or systemic reactions such as fever, discomfort at the site of the vaccine, or mild body aches. These usually last a day or two. There are very rare allergic or other reactions to vaccines, as there can be to other medications, foods, or to infections themselves. When making decisions about their children, many parents ask me what I did with my children. I have 5 teenagers, all of whom have received every recommended vaccination. I encourage you to fully immunize your children to keep them and the community safe from deadly diseases. If you stay with the standard vaccine schedule, your child should have most of the major immunizations completed between the ages of 4 and 6 years, with some very important additions in the teen and preteen years. If you have any questions or concerns, please contact one of our 24 pediatricians and set up an appointment. My partners and I look forward to meeting you and your children.